Welcome to Hilary Topper On Air, the podcast you
Every
can't
year,
afford to miss.
there are more than 100,000 deaths due to medical errors in the U.S. Some reports say it's more like 300,000. That's a very startling statistic. How can you protect yourself and your family from becoming a victim of medical errors? I'm Hilary Topper, and this is Hilary Topper On Air. Today, I'm speaking with Robert Fallarino, an attorney at Pegalis Law Group, LLC, on Long Island, New York. Hi, Bob. Welcome to the show.
Hi, Hilary. Thanks for having me.
So tell us a little bit about yourself and your background and the work that you do at the Pegalis Law Group.
Well, I've been an attorney since the mid-'80s, and we concentrate in medical malpractice on behalf of the patients. I've been doing basically trial work and things of that nature. And, you know, one of the things that we take the most pride in here at the Pegalis Law Group is that many of the cases that we're involved with also improve patient safety in the long run for all of Long Islanders and hopefully throughout the country by having best practices put in place. So that's, you know, one of the beneficial things I think we do with regard to the lawsuits that we pursue.
So now, preventable medical errors is the third leading cause of death in the U.S., and that's after heart disease and cancer. That's ridiculously scary. Can you tell us a little bit more about medical errors in the U.S.?
Well, and that initial report came out almost 30 years ago at this point. And some of the medical errors that we're talking about are very simple things that, you know, are things that are very preventable. But from the patient standpoint, one of the best ways to help prevent the errors is being very proactive and sometimes just, you know, standing up for yourself when you think the doctor, or if you're in the emergency room, they're discharging you too soon, just standing up and saying, you know, this is really, listen to me. This is what my symptoms are.
Mm-hmm. So are there any other best practices that you would suggest our listeners take note of when they go to see a physician or a surgeon?
Well, there's a couple of basic things, especially if you have some chronic illness or some medications that you're taking, is actually make a list of the medications so that you can hand them to the physician, even if you think you've been going there for a while, just to make sure that they know exactly what you're taking right now when you're seeing them. And that second part of that is if you're particularly concerned about a symptom or some reason that you're going to the doctor at this point in time, maybe bring someone with you to listen as well as you. Because sometimes, especially if there's a potential for some bad news or some scary news, you get, you know, paralyzed by what you're hearing, and you don't really hear everything that's coming out. So having a second set of ears is very helpful. Mm-hmm. I used the phrase, I don't know if you remember the Charlie Brown cartoons when the adults would talk. The Charlie Brown would just hear something like wah 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 wah, and so precisely when you're getting bad news or scary news, sometimes all you hear is the word, and then you're not hearing what you should be doing or anything else. So it's very good to have someone that maybe is more objective in that situation, that can really follow up with questions and say, okay, where are we supposed to go? What are we supposed to do? And really take notes or really listen for you so that the bad news doesn't overcome what you're supposed to do to get over the bad news.
Yeah, those are great tips. Those are really great tips. So again, we're talking about medical errors and what people can do to prevent this from happening to them. Bob, what does someone do if there is a medical error? What role does an experienced medical malpractice attorney like yourself play in this whole thing?
I think the best thing that we do is we provide answers, especially if you're not if when something that you think is untoward happens to you, or something that shouldn't have happened, especially if you're someone who goes to the doctor regularly and then you get a bad diagnosis out of the blue. And sometimes the doctor's not forthright and maybe a little scared to provide some of the details as to what maybe happened a year or two before. You know, we're one of those people that we can at least get you answers. Even if there's not a lawsuit involved, we can sort of sit down and explain it layman to layman, you know, what actually happened during your medical care. And then the second part of that is, you know, we're sort of like an insurance policy. If God forbid something bad ensues, you know, we'll get all the records and we'll do all the legwork for you to find out, you know, what you should be doing and what, more importantly, we can help you so that you can get the appropriate compensation, that you can take care of yourself or your family into the future.
I mean, this happens so often. So if they call the Pegalis Law Group, I was reading that you say there's never a fee for legal consultations. Is that true?
That's absolutely true, especially all the upfront costs. We only will take a fee at the end of the case if we're successful.
Wow.
So we'll take the initial phone call, and we have, you know, you speak with an attorney who's got over 30 years experience on that first telephone inquiry. And then what we do is we take the information and we decide if it's something initially that's potentially pursuable, and then we have a nurse on staff and we get all the medical records, and between the attorney and nurse we go through all the records, one from an attorney side, one from a medical side, and decide which experts are best to look at all of these records that we've assembled and which is the best avenue in terms of legal recourse that should be pursued, or if it even should be pursued. And so it's sort of like you come with your questions, and usually what happens is it's not so much bedside manner, but it's more what happened to me or what happened to my loved one, whether it's a spouse or child. And people are really looking for answers, and they think they don't have the right answers. And it usually initiates most of the phone calls to us.
And what if, God forbid, somebody does pass away due to a medical error? How long should somebody wait before they come and see an attorney like yourself?
And I think it's very important to understand, especially in differing states, there's a thing called the statute of limitations, but there's also a thing when it's a municipal hospital, a county hospital, a state hospital, which much shorter statute of limitations, what we call notice of claims or notice of intentions to sue. And they can be very, very short, as short as 90 days. And so really when you're thinking that something happened, you really, you know, it's very important to make that initial contact so someone can look at it legally as to when your time will expire to pursue any particular claim. And then, you know, if you have more time, obviously, you know, that would be great, but you got to protect yourself at that instance and not just wait and not rely on published or online statute of limitations, because you know, they may be a longer period of time than your particular hospital or your particular healthcare provides.
Wow.
Yeah, so it's a little bit of a trap that is unnecessary in this day and age. But you know, but it's still, you know, we have vestiges of old laws. As a matter of fact, you know, you brought up wrongful death in New York State. Our wrongful death statute was put into place at the time of the Civil War, and we really haven't updated it since. So there's some very old-fashioned concepts in that.
That's insane. I can't believe that they haven't done that.
Yeah. So the statute of limitations and also the legal recoveries haven't changed since, you know, before any of the modern amenities for certain.
Do you have any case studies that you can share with us that might help some of our listeners make a decision as to whether or not they should go to an attorney?
Well, you know, we're really not permitted to speak about individual cases, but I can certainly talk about it very broadly.
Okay.
You know, if you're someone who has been going regularly for your mammographies or your pap smears or things of that nature, and then after years of quote unquote normal or negative, you all of a sudden get not only a cancer diagnosis, but one that's a little bit on the advanced side. That certainly is a red flag that maybe something happened in a year or two prior that should have been delved into. We have, quite frankly, we've had cases where a report from a pathologist that was cancerous was misfiled or mishandled because there was multiple doctors involved, and everyone thought someone else was telling the patient. And it wasn't until they came back for their yearly checkup the year later that, everyone's face dropped and said, "Oh my goodness, you didn't know about this?"
Sure.
So, sometimes from a proactive standpoint, like you said earlier, we like the phrase "no news is good news," but sometimes no news is no news because someone dropped the ball. So if you've gone for a test or a study and you haven't gotten any kind of notification, even if it's the doctor's way of doing it that you've been going to for years, "Oh, I don't get anything unless he wants or she wants to see me," it's always a good idea to follow up, especially if it's something that you may be a little concerned about, to follow up and get that, get that result and make sure it's negative and make sure it's normal. Another avenue to think about is the sort of the drop out of the sky kind of diagnosis, and so those are like, they kind of go hand in hand, but they're things that you really want an explanation, and if you're not getting the explanation, that's a time a little red flag should go up that I need someone else to look at this or at least discuss it independently. So I think those are kind of the broad aspects of care. There's other simpler things that, are more hygiene related that you got to make sure if the doctors come into your room and especially in the hospital situation, that that they've at least used the hand sanitizer or changed their gloves in front of you so that you don't get communication from the patient in the next room or the next bed.
God.
Yeah. So that, that's like that you would think, again, in this day and age, that would never happen. But those things do happen, and that's how infection spreads out of hospital. That's one of the things that is very concerning, and it's very sometimes difficult to prove that it's a hospital acquired an infection, even so you want to make sure that you prevent it from happening rather than having to prove it later on.
Absolutely. And I love what you say about after getting a study or a blood workup to call your doctor, because I think a lot of people think that the doctor will call them if there's something wrong. And I think in this day and age, they're just not doing what they did, 20, 30 years ago.
Yeah, and that is a function of our HMO healthcare society.
Absolutely.
Where unfortunately they have a very limited time. If they they allot 15-minute intervals, there comes a point at which things might be simply dropped inadvertently, and you want to make sure that doesn't happen. Another area that I kind of touched on earlier that I think would be very helpful is, don't accept the answer, like, especially like if you feel something like let's use a breast lump that's different this month or it's changing over time. Don't accept an answer like, "Oh, you're too young to have breast cancer," or "Don't worry about that and come back and keep delaying taking a sample of that." Or anything like that. And for your male patients, don't let a prostate exam saying, "Oh, it's a little enlarged." Don't let it be something that you don't follow up, quickly and in the right time frame. Because those are all things that, sometimes, because most exams are normal and most people, even when they get biopsies, it comes back normal. Sometimes doctors, and it's just almost like a human nature thing. It's, I felt this 10 times last month and nothing turned out, and I put people through a biopsy, so I'm not going to do it this time. It's the 1 in 10, that can be cancer or can be something malignant, and not the other way around. So you got to be. That's why you're being preventative. You're not doing things to wait till it gets big enough that you don't really need a doctor to diagnose it. You're really trying to be proactive and get it at the earliest possible time, even if it means, a couple of more extensive testing you maybe want to go through.
It's great. Really fantastic advice. So tell my listeners how they can get in touch with you and learn more about the Pegalis Law Group.
Well, we're right here on Long Island. We're on the Nassau-Queens border, so we're active throughout New York State. And actually, I'm licensed. I myself am licensed in North Carolina, District of Columbia,
Wow.
and we also join with other lawyers in other states, for example, Connecticut and Pennsylvania at the current time for individual cases. But we don't have lawyers from those states at the current time. But we will review cases, and basically we have an 866 MedMal 7 is a toll-free number. But we're also at PegalisLawGroup.com. And, if you were to just simply use a search engine to look for either our law firm or my name, Robert Fallarino, I think it would be very easy to come up with contact information. And that way you could simply, like we said earlier, ask your questions of someone and just even if it's a 5-minute conversation that puts your mind at ease, and we think there's no case and that this is exactly what unfortunately should have, what was your life, what was dealt you in your life, that can put your mind at ease that no one did anything wrong as well. That's actually very beneficial and helps you fight the next fight.
Yeah, and I love that you guys, that my listeners or anybody out there can call your office, and there's never a fee for a legal consultation. And again, I'm talking with Robert Fallarino, and he's an attorney at Pegalis Law Group on Long Island. And the number there again is 516-684-2900. Thank you so much, Bob, for being on the show today. And thank you to the Pegalis Law Group for sponsoring the show. I also want to thank our listeners for tuning in. And if you want more information on this show or any other show, check out our website at hilarytopperonair.com, or you can find us on Spotify, iTunes, Google Play, SoundCloud, Amazon Alexa, you name it, we're out there. Have a great week, and we'll see you next time.